listening to Next Level Thinking on St. Martin Gov Radio 107.9.
Welcome back, listeners, to Next Level Thinking. My name is Caroline van Oost. I'm a psychologist and a member of APAP. That stands for Association of Psychologists and Allied Professionals St. Martin. I'm here together with two other members, Alexandra van Luiken and Joyce Begonje. For those who are just now joining, we have been discussing hurricane stress. Hurricane stress, something that we all became too familiar with after Irma last year. But actually it was already there before for a lot of people who experience more hurricanes. Because we live in a hurricane-prone area, it's something we have to deal with each season over and over again. It's a normal thing we discussed. It's something that is a normal reaction towards what we're dealing with over here. So it's not abnormal to have hurricane stress. But there's a thin line between normal and abnormal. It could become too much. There are ways that you can provide self-care or care for others to make sure that the stress doesn't become too much. But sometimes it does. And then it's good to know that there are also options to deal with that. Well, that's actually a common topic that we have been dealing with in the last year more than before. That is, for example, dealing with post-traumatic stress. Because when it becomes too much, sometimes it could become a disorder. You could talk about post-traumatic stress disorder, anxiety disorder, or depression. Those are all consequences of too much stress. At a certain moment, you can notice that it's more difficult to do your daily life tasks, or that you're affected by it more than you were affecting by other things. You just do not feel yourself. And at that moment, it might be good to think about, hey, maybe I need some extra support. And you do not immediately have to go to a psychologist. You can also go to friends or family or a counselor. But if it's really something that needs some extra psychological support, don't be afraid to ask for it. Let's talk a little bit more about the options that we have within our field to deal with those kind of psychological problems. Alexandra, what is your experience as a psychologist in that sense?
The most important advice that I would give listeners is that when there's doubt on how you're feeling, it can't hurt to contact your medical doctor and ask that referral to a psychologist. The intake in itself can give clarity, and when there's doubt, it means that you might be off balance. You mentioned the post-traumatic stress disorder or the post-traumatic experience. When the event that you experienced, like Irma, I think there were many people that actually had a real traumatic experience. And a trauma that can develop like that is basically the stress that's not being coped with, or that the event was so severe that it tipped you out of balance for long term. The risk with continuing not to give attention to a situation that caused you trauma is that trauma can have long-term negative effects on your functioning. So trauma, if you feel that you're not bouncing back to yourself, please indeed go to get help. Or if you realize that someone in your surrounding is not bouncing back to their normal self, then it might be that for sure it cannot hurt to follow up and have a psychologist help you make that decision.
We are used to go to the doctor when we feel ill. We are used to, especially after the hurricane, everybody went to their insurance company because their house got damaged.
Yeah.
If you got damaged,
after
emotionally
the hurricane,
seen.
What you saw actually is that a lot of attention came for that psychosocial care. People were more aware of the mental impact that events like this can have on the society at large, but also on each individual. In case that there is a situation that we can talk about a post-traumatic stress disorder, that is a situation that needs treatment and that can have an effective treatment. Basically, the sooner you're able to start treatment, the more the chance of dealing with that diagnosis is available. There's two general effective therapies that are available. We have the EMDR and we have the cognitive behavioral therapy, both proven in the scientific research as being effective, but also now again in the after Irma situation here on the island, we've seen that within reasonable time, I would say, because it's not a 1, 2, 3, but with both treatments you see effects.
The EMDR, that's something that people would say. The EMDR, that's like a difficult word. When you say it fully, is eye movement, desensitization, reprocessing therapy.
Correct.
So EMDR. Joyce, have you heard about EMDR?
Well, in a matter of fact, I did, but not as a profession.
Mm-hmm.
I heard about before EMDR, but not quite as much. And I'm not an EMDR therapist, but I just, in my personal life, I just experienced it with my daughter.
Okay.
Also related to Irma's stress. After Irma, a few weeks, I noticed that she was doing something different than she normally was. She was a different person. And because of my background, I'm beginning to started to structure right away after the hurricane, and I try to give them a stable base and also listen to her when she mentioned the topic. But still there was something going on, broken nights, bad dreams, behavior that was about to become out of control on school. So I had to do something else. But then again, I thought I had everything covered.
But that shows, right? Even if you got everything under control, but you cannot always have, by the way. But in that sense, it can happen to everybody. So that's good to be aware of. It's not something that only happens to the weak ones. No, it can happen to everybody.
No. And in fact, Alexandra already mentioned it happened to all of us. So we all having our stress problems, only the level of it and how we work through life with the stress. If it's just giving you problems, then it's a thing to reach out for help if you cannot do it by yourself. So I did, and I reached for help, and I got my daughter to an EMDR program, and it worked very well, actually. And slowly she became back on track. But now still I wondered if I could have missed some signals, or did I have to step in sooner? So sometimes it's difficult when you're seek for help.
Yes, indeed. And how do you seek for help? Here on the island, you have different ways. I think you can, the most important one is go to your house doctor and discuss over there first how you're doing and what your complaints are. And then your house doctor will think along with you if a psychologist is needed. You can always contact us as APAP as well, of course, if you want some more information just about what is post-traumatic stress disorder or what's hurricane stress. You're always welcome to ask us for help. We cannot provide you the therapy as an association, but we can refer you to professionals who are members of us who are able to do so. So you will know you have quality care that can be provided to you. And we have psychologists on the island who can provide EMDR, and that's indeed one of the most effective trauma therapy. So there are things to do on the island when you experience the stress more than normal. So today we talked about hurricane stress. Hurricane stress is a real phenomenon, something that we have to deal with while we're living in a hurricane-prone area. Especially in the hurricane season, we probably sometimes relive what we experienced last year with Irma. This is normal. It's normal to feel abnormal at first. But when it stays like that for a longer while and you're not able to function properly, it might be a moment that you have to seek help. And in preparation of a storm, when it's coming, make sure that you do not only prepare your house, but you also prepare yourself. Check up on yourself. How are you doing? How are you doing? How is your loved one doing? Make sure that you provide some extra self-care, sleep well, eat well. And when it becomes too much, seek help, seek support, talk about it with somebody, do things that give you less stress, find some healthy distraction, or go to your house doctor, because there are options on the island that you can go to get some extra psychological support, for example. So hurricane stress does not make any exemptions. It all affects us. So make sure that you're aware and prepared. So this was our episode today about hurricane stress. And thank you all for listening. My name is Caroline, and I was here today with Alexandra and Joyce. This program has been made possible by the Ministry of Health and DCOM. Please follow APAP on Facebook to stay updated with our journey to inform the community and strengthen mental health care on the island. And don't forget to tune in again next time to Next Level Thinking on St. Martin Gov Radio 107.9 to learn more about the curious and fascinating ways of human behavior, psychology.
Next Level